Hi, Christopher Watson here, coming to you from Empowered PAs with the Empowered PAs podcast. So this is another installment. This is our November installment. Typically, I like to try and get guests on here so we can do more of an interview style, kind of talk back and forth, so you don't have to sit there and listen to me talk all night. Hopefully, I find it a little more interesting when you can carry on conversation back and forth, but so you got me on this episode. Hopefully you'll stick around and finish the episode. But today it's November, and so a lot going on in November. This week, actually, while I'm recording this, is Nurse Practitioner Week. So I'd like to give a shout out to all the nurse practitioners out there, our colleagues who do a wonderful job, just as our physician partners and ourselves, in taking care of patients in our community, in our workplace, and just really extending out good quality patient care to their communities. So here's to you, the nurse practitioners and Nurse Practitioner Week. It's also No Shave November, and bring awareness to prostate cancer, of course. And then, of course, with No Shave November, some of you may be growing out your beards and your mustache, but if you're in the military, you cannot necessarily grow out a beard for sure, depending unless you're in special forces or in a undisclosed area of the government in the military that you cannot speak its name. Hence, if I told you, I'd have to kill you, right? So otherwise, in most regulation, whether it's the Air Force, Navy, and the Army, you have to be pretty much clean shaven versus certain regulations on a mustache. As you see, I do not carry a mustache currently. If you didn't know this, I'm also a PA in the Army Reserves, and November the 11th marks Veterans Day. So let's talk about Veterans Day a little bit. So there's a little bit of difference. A lot of, whether it's our colleagues and definitely a lot of people out there in the U.S. get Memorial Day confused with Veterans Day. Veterans Day, we honor all people that serve in the military, especially of foreign wars and that have served in conflict as well. Whereas Memorial Day, you take that time to observe those who have died, given the ultimate sacrifice for our country. So let's talk about Veterans Day. How that ties in with us is the profession that we love and that we work in every day, based out of a need, a shortage of physicians. And what happened was, back after World War II, you started noticing, or at the time, they started noticing a shortage of physician providers, especially in general medicine, primary care, even in the rural areas. And that still rings true today because of specialization into different surgeries and other specialties within the practice of medicine. Well, they also noticed that Navy corpsmen and other medics, like Army medics, had definitely a lot of training and skills. And kind of based on a model where you're trying to get a lot of physicians out, especially during wartime, during the Vietnam War, to handle sort of the need at the time, they took that plan, and initially it was a nurse. And if I'm not mistaken, it Miss Thelma Ingles. And what she did was developed a direct physician assistant, but with nurses, but a program developed to be that gap, fill that gap where there was a lack of physicians. And that was in the in the 1950s, and had presented it to the National League of Nursing to accredit this and approve it, and it was not accredited by or approved by the National League of Nursing. So it didn't die there, but it ended currently in that state there. Well, in 1960s, it didn't die there because Dr. Eugene Stead worked with Thelma Inglis to continue to develop this type of system, and they call it a physician assistant. Sometimes in the early it was referred to as a physician associate at times, but a physician assistant. And the first program was developed and handpicked by Dr. Eugene Stead with 4 Navy corpsmen. And the first program was developed back in 1965, and that was the first program back in Duke University. And a lot of you realize that, and that the PAs know that that's the first program was at Duke University. Maybe some pre-PAs that may end up watching this don't realize that, but that's our roots. Our roots are coming from the military, and it's coming from the first program was developed in 1965 at Duke University. So they got that off the ground running, and the first 4 that were picked, their names were Don Guffey, Vic Germino, that is, and Dick Scheel, as well as Ken Farrell. Now, only 3 ended up graduating at the end, and they ended up with certificates at the time. Later, that program developed into a actual degree, but it took some time. But the first few graduates did graduate with certificates at that time. So Dr. Steed and Dr. Mao, while developing the program, would periodically visit Fort Bragg in North Carolina, which is a Army installation that's still there today. And they would go and see how the Army medics, well, more specifically the Special Forces Army medics, were trained and how they integrated within their units. And what they took away from and very impressed with was how advanced the Army medics in the Special Forces units were trained. They were trained with skills far beyond many, and they were able to integrate within that unit and take care of that unit's need, especially out in a combat zone or hostile environment, without the need of a physician right there by their side the entire time. So they took some of that model and brought it back and integrated in with their model of the PA program at Duke. So that was part of that integration as well. So PA started serving in the Army specifically in the 1970s, and they've played a vital role in the military and the Army as well since then. So the U.S. Air Force was actually the first branch to develop their own PA program within the military. And that was started back in 1971 under the guidance of Lieutenant General Alonzo Tower at the time. And so shortly after that, like any good program, the Navy and the Army followed suit right afterwards. And many people that maybe listen to this have gone on and graduated what they call the IPAP program, the Interprofessional Physician Assistant program, as well as gone on and served in our U.S. military. In 1980 and 1981, the Army started developing specialty programs for PAs within the Army. Those included emergency medicine, orthopedic surgery, occupational health, cardiovascular perfusion. There was a couple more. Aviation medicine. Let's not forget that. That's a huge thing within the military, is the aviation medicine. And those areas of specialty continue today, to the fact that you actually graduate, especially with the orthopedics, emergency medicine, you actually graduate with a doctorate level degree from those. I know one is with Baylor University currently, but that has developed over time and it continues to this day. So with all that training, the PAs in the military has been a vital role not only in taking care of our military members and service members, both filling the primary care role when stateside and at the home front, but also serving in the emergency medicine setting, even at home, but also overseas and in combat areas as well. And they've played a vital role, including filling the gap where there is not there's lack of physicians. So in the military, and I can speak for the Army because I see it, because I currently serve in the Army Reserves, there's still a lack of physicians even in the Army. And there can be a debate of why there's a lack of physicians in the Army, but at the same time, there is that shortage of physician providers within primary care and on the civilian side as well, primary care and family medicine type service, and even in the rural and urban underserved areas. And so that's where PAs and nurse practitioners can fill that role, and that's where they do so currently as well. And so PAs fill that gap even in the military today. And so what you also get with PAs in the military is not only are they serving our country, they're serving our military men and women and their families both at home and abroad, but they also are developing as leaders. You hold leadership roles in the Army, especially. I can speak of the Army because that's what I'm in, but in all branches of the military, Navy and Air Force as well, they hold leadership roles in that areas too. It wasn't until the 1990s that the Army actually decided to make PAs a commissioned officer, so at the officer level. At the very early stages, it was an enlisted position, and then it turned into a warrant officer position, and finally into officer, where it's lieutenant, second lieutenants, captains, major, and you can move up the ranks, so forth. Air Force and Navy were the first adopters of the commissioned officer as a PA. But that continues today, which is a way that you do keep PAs in the military by having that officer position. But also they develop PAs as leaders. And PAs, I've often mentioned this to my colleagues, that just naturally, you as a PA, you are a leader, whether you see yourself as a leader or not. Just the difference is that the Army does a good job of developing you as a leader. Or I say the Army, again, I'm in the Army, but the Air Force, Navy as well. They did a good job of developing you as a leader. So at this Veterans Day, I reflect back on our roots. Gave you a little bit of history, but there's a lot of us that have either served in the military and are now PAs, or currently serving on the active duty side or as the reserves. I currently serve in the reserves. There's plenty of our PA colleagues out there that are currently active duty, both in the Air Force, Navy, and in the Army itself. And then, of course, you have your prior service members that have either been a PA in active duty and since have retired or gotten out of the military and still practice as PAs, or once served at a totally different job, or as the Army says, a different MOS. And now they're have gone through PA school through the civilian side and are now practicing as PAs after they've fulfilled their duties in their service. There's physicians that's done the same thing. There are nurse practitioners that do the same thing. So, but speaking for Veterans Day from the Empowered PAs, as the podcast that we're currently doing, going back to our roots, we were developed from the military because of a shortage of providers after the war serving the rural and underserved areas. And so it's a way, and continues to be a way, to serve for the lack of physicians, or the shortage of physicians. Not because there's a lack of want to in physicians, there's more patients than there are physicians, and it's a way to make sure that you're getting access to health care to everyone out there that needs that access. It was back in the 1950s, 60s, and 70s, and continues today. So PAs will continue to play a vital role not only on the civilian medicine, but also in military medicine. So here again, we want to say thank you for your service. I know that's kind of tongue-in-cheek sometimes to some of our military friends out there, but we do want to pay honors and respect to those that have served in the past and that are currently serving in our military. And so let's talk about that. So where are some opportunities for you if you're a young PA, or if you're a pre-PA student that's looking to go to PA school, or maybe that you're currently in PA school? You should look into that as an option when you get done with your PA school, or prior to getting admitting to PA school, is an option to serve in the Air Force, in the Army, in the Navy. Not to mention, if you look into it, they tend to pay for your school. I know the Army's had a program where they reimburse you for going to school. The Navy and the Air Force have had programs in the past where they actually pay for you to go to PA school. So I encourage you to look in that as an option too, if you have that desire to serve your country and also be a PA. You can contact your recruiters. You can reach out to me. I'll be glad to talk to you about it. And reach out to any other PAs that have military background. So again, look forward to seeing you. Let us know what you think, and if there's any topics in the future you want us to discuss, please let us know.